everyone. Welcome to my Facebook Live that I'm doing every week. My name is Wendy Myers. We do the Facebook Lives on Tuesday at 5 p.m. Pacific and 8 p.m. Eastern. I'll be here every week to answer all of your questions about detoxification and to give you different lectures on different types of toxicity. Like this week, we're going to be talking about thallium toxicity. We're going to be talking about how thallium toxicity causes chronic fatigue and why it interferes in your mitochondrial functioning and how exactly thallium interferes in mitochondrial functioning. We're also going to be talking about learn why thallium is prevalent in those who live in urban areas and how to detect thallium and how to detox thallium. I'll be talking about some supplements that are really, really effective at detoxing thallium. And thallium is really important. It's one of those things that a lot of people don't talk about that are maybe experts in detoxification or who are detoxing their clients are not aware of it. And there's like when people are using analytical research laboratories to do hair testing on people, there isn't any thallium tested on that test. And so a lot of practitioners that are using that lab are not aware of thallium or its existence or how to detox it. And this is a big problem because thallium is a big cause of chronic fatigue today. And that's why it's really important to talk about this. I have an article on my website called Thallium Toxicity, and we're going to discuss it today. So thank you so much for joining me. I'm here every week on Tuesday at 5 p.m. Pacific, 8 p.m. Eastern. I want you to ask any question you have about detoxification, any question you have about supplements, about testing, about just anything related to detox protocols, infrared saunas, coffee enemas, whatever you or have any burning question you have in your mind, I'm going to answer it for you today on this live broadcast. And if you miss any part of the show today, you can watch it again anytime on our Myers Detox Facebook page or on my YouTube channel, youtube.com/Wendy Myers. And so let's talk a little bit today about how thallium toxicity causes chronic, unrelenting fatigue. So any of you guys that are tired, any of you guys that may be suffering from chronic fatigue syndrome, thallium is always going to be a component to that. Because what thallium does is it poisons an enzyme that transport nutrients into your mitochondria. And your mitochondria are your little cells, powerhouses. They make your body's energy or your ATP. And when you don't have the nutrients needed to do that because the enzymes have been poisoned, you're going to be tired. You're not going to be able to make the energy your body is capable of making. And so thallium is a big component in causing those types of problems. And so let's also talk about why thallium is prevalent in those who live in urban areas. So thallium is primarily emitted into the atmosphere from gasoline, so from car exhaust and smog. Thallium is present in all of our petroleum deposits, and so thallium is an issue whereby people are breathing it in. It's emitted into the air from exhaust, and then we all are breathing this in. So that's why a lot of people have fatigue issues, because they have a lot of thallium present in their bodies. And so let's talk about some of the other symptoms that are caused by thallium toxicity. So it's pretty long. Thallium toxicity can present itself as abnormal heart rhythms, as abnormal reflexes or vision. People can have abdominal pain. They can have acne. A big prominent symptom is alopecia or hair loss, autoimmune hair loss. People can have bone marrow issues where their immune system is depressed because thallium will deposit in the bones and also deposits in the hair and the skin. People will have brain fog. They can have burning sensations. They can have constipation, chronic fatigue, as I already mentioned. They can have degeneration of their heart, liver, and kidney, where thallium also stores in the body.
In some movies that are
people that have dementia, depression, they can have fever, they can have gluten sensitivity as a result of this. They can have headaches, high blood pressure, inflammation in the oral area, the lips, gums, and mouth. They can suffer from insomnia, leg pain, loss of appetite, malnutrition due to thallium's interference and absorption of nutrients. Definitely a big factor in interfering in gut absorption. People can have muscle aches, weakness, and tremors. They can have nausea. They can have Mies lines in their nails. So people can have little lines in their nails as a result. They can have numbness, neuropathy. They can have respiratory issues. They can have seizures. They can have skin issues in their feet and in their tibia, the lower extremities. They can have urine discoloration, which is going to be green after exposure. They can have vomiting and nausea. And they can also have damage to the nerves controlling the muscles of the head and the neck. So it's a lot of different symptoms can be the result of thallium toxicity. I found all this in doing research.
Today, sir.
Research in PubMed and all of a lot of different studies showing that these are symptoms as a result of thallium toxicity. And first, the toxicity or the thallium enters our body in our gut. We have like the gastrointestinal phase of thallium toxicity, where it's in our digestive tract, causing poor absorption of nutrients. Then it'll enter the neurological phase, where it deposits in your brain and starts causing problems neurologically. And then the hair phase, when people are very, very toxic with thallium, will start having hair loss as a result of that. And let's talk a little bit about some of the supplements that detox thallium. Let's talk about how you're exposed to thallium. So I mentioned that it's present in the gasoline. It's present in the air. We breathe it in. It's also in ant killers. It's used as a pesticide. It can be used in some cardiac scanning. So thallium isotopes are used in this procedure. It can be exposure from working in a cement plant. It can be in coal ash, because coal is part of the petroleum deposits. It can be actually in kale and cruciferous vegetables. And this is kind of interesting because there's a 2006 study that found that the cruciferous family of vegetables, namely kale, cabbage, cauliflower, and broccoli, are hyper-accumulators of thallium. But the issue is that, kale is kind of the queen of the cruciferous vegetable, group. And the kale is, more of a hyper-accumulator than those other vegetables. And even organically grown kale is shown to have higher levels of thallium than conventionally grown ones. And it's really, they think, because of the sulfur content, the high sulfur content in vegetables. That's why it's attracted to thallium. And so here's the problem. That doesn't mean don't eat kale. All of our vegetables and all of our meats and other things that we're eating, the air that we're breathing, has contamination in it. It's just, you just want to be aware of that and do a sensible detox program to get rid of all these toxins that we're accumulating in our diet, in the water, in the air. And so unfortunately, all the vegetables we eat have some level of contamination. That's just an interesting side note. And then we can also get thallium in lead smelting, so people working in manufacture of electronics, and optical lenses, jewels, imitation jewels, semiconductors, green-colored fireworks, and low-temperature thermometers. People can get exposed to oil drilling because it's in petroleum, production of photoelectric cells, rodenticides, so pesticides used for rodents, soil also, because anything that's released into the air can then settle into the soils and get into the food supply. And water fluoridated with fluorosilicic acid can contain thallium, and zinc smelting. And so those are the primary ways that you can get exposed to thallium, but it's mainly in absorbing, breathing in air, breathing in the exhaust. And so great. So thank you everyone for joining. We have about 50 people on the Facebook Live right now, and I'm going to answer all your questions in just a second. So I want to talk about the places in the body where thallium tends to reside. So these are the places that thallium will accumulate and then will be primarily affected by the thallium toxicity. So bone is primarily where the thallium will accumulate, and that's why it can cause bone marrow and immune system suppression. It can accumulate in the hair, And ironically, though, it does accumulate in the hair, but we don't typically see that on a hair mineral analysis. So thallium is one of the items that's tested on a Trace Elements International hair mineral analysis, but ironically, we don't really see it in the hair. We see it indirectly with potassium levels, low potassium levels on a hair mineral analysis. Any lab will show this. So if you have low potassium levels, which most people do, that is due to thallium toxicity. So many people, so many practitioners are perplexed as to why people's potassium is always low. I mean, people do have plenty of sources of potassium in their diets. It's not necessarily a deficiency for many people, but thallium blocks potassium channels in the body, so it interferes with potassium's functioning in the cells, and as a result, we see low potassium levels on hair mineral analysis. So that's a classic indicator of thallium toxicity, and that's primarily how it's determined. That's how I determine it. That's how all the practitioners that are doing my Myers detox protocol with our clients are interpreting that. And the other way to detect thallium toxicity or verify that is with a urine test. So doing a DMSA challenge with some BioSil. BioSil will help to increase the amount of thallium that's released into the urine. And so that's also a great way to verify or detect that you have thallium toxicity. And most clients, when you do a urine test, have some level of thallium toxicity. So we also see thallium in the heart. So it accumulates in the heart, it accumulates in the kidneys, it accumulates in the skin, and it also accumulates in the spleen. So it will affect immunity in that way. And so how do we detox thallium? So we all know this is a big problem for many people. How do we get it out of our body? So this is one of the reasons I developed my mitochondria detox, and I'm going to put a link for that in the show notes. There'll be a link here to be able to go to the page where you can learn more about my mitochondria detox. And so one of our moderators will put a link in the show, the comments about where to go to find that. So what that entails is a product called activated silica, and that's something that it's a new supplement that we have at Myers Detox. And you can go to store.myersdetox.com to find that, but there'll also be a link in the comments. And so this activated silica is a special kind of silica that is designed to grab onto thallium and mobilize it from your tissues. And there's another product in the mitochondria detox supplement kit called CitraCleanse, and that's a modified citrus pectin that will also absorb and bind to thallium and remove it from the body. So it's kind of like this 1-2 punch. It's really, really effective at detoxing thallium and other mitochondrial poisons that reduce your energy production, like arsenic, aluminum, tin, and cesium. Antimony is another one, but it's not as common. But it also gets the thallium that we're talking about today on the Facebook Live. And so that's really the most effective thing that you can do to remove thallium. And that's what I give all my clients that are on the Myers Detox protocol. There's other supplements as well that work really, really well. Diatomaceous earth is also something that detoxes thallium. DMSA will detox thallium. Prussian blue, that's another product that will help with detoxing thallium, and potassium. So simply supplementing with potassium or foods that have potassium will help to push thallium out of your body. But you can't really get more than 5,000 milligrams of potassium a day because you can get toxic with potassium. So most of us get what we need from food. Some people do need to supplement, but probably not the best approach, but it's very, very effective if you do happen to be deficient in potassium. But probably the most effective thing you can do is the mitochondria detox. That's going to have the 1-2 punch with the silica, the activated silica that's designed specifically to bind to thallium to remove it, and the modified citrus pectin, which absorbs it, and then you just urinate it out. So that's a great approach. And so I'm going to take any questions that you guys have about thallium. So I'll start here from the beginning. So Blaze, again, thank you so much for joining us. You're always one of the first person to join in, and I appreciate your coming in every week and tuning in. And so Penny, so thoughts on biofilms and removing it to deal with candida, parasites, etc. So we have a great product called Lauracidin that we use to blast biofilms so that you can then deal with candida and parasites. Lauracidin is amazing. It's made from coconuts. And so we have that in the store. It's at store.myersdetox.com.